People are worried about sending their kids back to school. The CDC and others have issued guidelines on how they can return safely, but will need cooperation from the federal government to make that possible, and that isn't looking very promising. That's the topic of this week's Healthcare Triage. School is important for kids in more ways than one. Beyond academics, they're gaining important social experience, opportunities to be more physically active and mentally engaged, and for some kids, it's important for basic necessities like food and healthcare. School is also important for parents, many of whom rely on it as a form of childcare so they can work. Getting kids back to school is important, but we have to do it safely. The CDC recently released guidelines on K-12 schools reopening in the fall. They, of course, recommend staying home when you're sick and reinforcing appropriate health behaviors such as good hand washing and covering coughs and sneezes with tissues that are then discarded. They also recommend cloth face coverings be worn by both staff and students whenever possible, especially in situations where physical distancing is difficult to maintain. Supplies should be provided to allow scheduled, adequate cleaning and disinfection. That may also require increased janitorial staff. Desks and other seating should be spaced 6 feet apart at least whenever feasible, and distance should be created in other usually crowded areas as well, including school buses. Physical barriers like sneeze guards and physical signs such as tape on the floor to mark 6-foot distances would be a good idea. Children should bring their own food, or individually plated meals should be served, but not in a communal place like a cafeteria. Buffet-style meals are not a good idea. Children should stay in the same groups with limited mixing of staff between them. Schedules should be staggered as much as possible. Trained backup staff should be available to take over in the event of illness where regular staff may need to stay home and quarantine. The CDC recognizes that virtual learning is the lowest risk option, but the limitations of virtual learning have been high. Some students never participated, and many that did struggled immensely. Parents struggled too in more ways than one. While full-size, non-spaced, in-person learning is rated highest risk, we can implement CDC measures to create a modified learning environment that sheds many of the issues attached to virtual learning. This will require more space, more staff, and more supplies and equipment. And all of that will cost money, a lot of it. It's estimated that the total additional expenses an average school district would incur to reopen safely is over $1.7 million. That's expensive, but we still need to do it. Support from policymakers has been lackluster so far. The current administration has asked the CDC to relax their safety guidelines. The CDC refused and has even gone so far as to threaten funding cuts if schools don't fully reopen. Reports suggest that education spending will be a top priority as Congress moves to pass another coronavirus bill. We, along with many parents, and I happen to be one, hope this materializes in a meaningful way. Too much hangs in the balance for us to get this wrong. Hey, did you enjoy this episode? You might enjoy this other episode on to mask or not to mask. We also really like it when you like and subscribe down below. You might also consider going to patreon.com/healthcaretriage, where you can help support the show even as we try to get through a pandemic. We'd especially like to thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral Sam.